So this is the lecture for music and health. And I think today's lecture is probably going to be a little shorter than most of them. I think the reading does a pretty good job of laying out the material, and there's really only a couple of concepts that are really important for us to understand. The first is to understand the difference between three types of fields within music and health, and one is to differentiate between music therapy, music medicine, and then the last is performing arts medicine. So music therapy is probably the thing that you are most, maybe not familiar with, but you've heard most often. And it's a clinical and evidence-based use of music interventions to accomplish individual goals within a therapeutic relationship by a credentialed professional. So that's kind of a lot of words just saying that normally it's a therapeutic intervention to address some need of the patient. And a lot of times when we think about music therapy, as opposed to music medicine, it's a little more global, but it doesn't address a specific physiological need, but it normally addresses a certain affective or emotional need, or some sort of just general quality of life need. So what are the qualifications to become a music therapist? Well, they need a bachelor's degree or higher in music therapy from one of over 70 AMTA, that's the American Music Therapists Association, approved college and university programs. So there are about between 70 and 80 programs in the country, and you can get credentialed to become a music therapist. Music foundations, clinical foundations, and music therapy foundations, they are the ones that have kind of set up the regulatory guidelines for what music therapy is. In the text, the chapter, it kind of talks about a little bit about the history of music therapists. When it's interesting when you look at that, how certain institutions like the University of Kansas was really important in the creation of these professional organizations that help regulate music therapy. So the degree is kind of the most important thing as far as becoming a music therapist, but part of that degree is normally a 12-hour clinical internship, which is about 6 months. So it's kind of like student teaching in some ways, where you spend 6 months working in an institution of some sort, be it a hospital or a nursing home, something like that does music therapy. And then also, in order to get an additional credential called the MTBC, that's board certified musical therapist, you sit for a national board certification exam. So, so if you want to have that title of board certified music therapist, then you have to take this exam. So some of the things that the most music interventions do for music therapists are to promote wellness, to manage stress, alleviate pain, express feelings, enhance memory, improve communication, and promote physical rehabilitation. So like I said earlier when I was talking about the distinction between music medicine and music therapy, like those are pretty general outcomes. Promote wellness. That's not that's different than lowering blood pressure, which is a very specific physiological outcome. So music therapy, it can be both stimulative or sedative, depending on what the needs of the patient are. As you read in the text, music therapy is used with really young infants, neonates, in fact, in that certain music helps promote weight gain. In the text, it also talks about using music therapy with patients with autism. It can help with communication with those students. Cerebral palsy, it helps express emotion. Dyslexia, it helps them with some reading skills, in fact. Let's see. It's also involved in psychiatry, you know, and neurologic music therapy, where it helps with Parkinson's patients. It helps them to stabilize some of their motor coordination, which is pretty interesting. It also helps in brain injury rehabilitation. Gabby Gifford, if you know who she is, she was the congressperson from Arizona or New Mexico. I can't remember which one. One of those. I think it's Arizona, where she was shot in the head, and she had traumatic brain injury. And actually, when she was relearning how to speak, they used music therapy, and they helped her. Through singing. It was kind of a scaffolding technique that they used to help her regain her ability to speak, which she still has a lot of trouble speaking now. There are also music therapy, music activities to modify behavior over time. In the text, it talks about that student that had negative behaviors, and they had him learn the guitar, and I think it was a guitar. And over time, he had fewer negative behaviors and more positive behaviors as he was doing some music learning. And then also music on healthy aging. And I guess this is where I'm going to talk a little bit about, there is a documentary on Netflix right now. It's called Music Alive. And I thought about making you watch it, but maybe with the brevity of this lecture, you'll take that extra time and go at least start watching the documentary. It's called Alive Inside. And it is a phenomenal documentary. It shows there's a person that goes into nursing homes, and he gives people their personal music back. So he asks people what their favorite music is, and he puts it on an iPod, and then he puts earphones on their ears, and it's just unbelievable. I mean, granted, we have to remember that we're an audience and we're seeing the most dramatic cases, and I'm sure it wasn't that effective for every person that they gave the music to, but it really looking at this population that's so often overlooked, people that have dementia or Alzheimer's that really are not communicative, that have been pretty much thrown away by our culture, where you see them start moving to music and they can actually communicate to the staff, which before they may not have been able to speak to the nursing staff. It's really, really worth your time. It's only about an hour and a half long, I think. And I mean, like, you can't go probably 10 minutes without crying. Like, every 10 minutes, there's just an episode that is just really very moving. And it's really worth the watch. But I am going to be a little critical of it, because they definitely, they kind of say, oh, this is a way that we can help, people get back their younger self or connect to their former memories, that kind of thing. And I do think there's some truth to that, but I also think, as it's stated in the book, like, it kind of assumes that, oh, just by listening to music, that's enough to kind of get the benefits of music. And as the book states, just listening to music, while it does have benefits, it's not nearly as the benefits aren't nearly as strong as interventions where they are actively making music or making music with other people. And that's when, kind of, if you're in my class last semester, our seminar class, where we talked a lot about, the importance of what music is and the connection between people, the social, that social component of what music is. And I think that's what they're starting to tap into. And so part of me wishes that they would take it a step farther and see how they could get people to, how they can get this population of people that seem really far gone as far as their memory abilities. Shh, shh, shh. Stop barking. Roxy. Shh, shh, shh. Yeah, so if they could use more more interventions that include music making, it would be interesting to see what impact that has on that adult population. And like I said, we need to remember that that's a documentary, so they're really showing, the extreme cases. And, probably most people don't have the benefits that they showcase on the documentary. But it was really worth your time, and you should look at it. The documentary is called Music Alive, and it's currently on Netflix. So now we're going to change gears just a little bit to talk about music medicine, which, it's a little, like, the distinction between music medicine and music therapy is probably not a distinct line, but it's probably more from, think of it, sorry, there's a lot of noise in my apartment building, and so Roxy's not happy about it. So one of the distinctions between music medicine and music therapy is that is one way to think about the distinction is who is using it. Is it a licensed music therapist, or is it a doctor or a nurse or someone that is on the medical staff that is using some sort of procedure or intervention for a specific medical goal? Hold on.